I'm going to just go ahead and introduce. So this is, I think, our third or fourth podcast now. The first couple of podcasts we were doing is on history of various types of procedures. This is our first podcast we're doing with an actual patient. So congratulations. Okay.
Thank you.
So to the whole world out there, this is Aura. Aura is one of my patients. And I'm going to kind of ask you a few questions, Aura. You can introduce yourself. And so I'm going to start with first, why don't you introduce yourself, tell everybody what you had done, and then I'll get a few questions down.
Okay, my name is Aura. Okay, I'm 66-year-old. I'm a personal trainer.
Woo!
And I'm very concerned about how I looks and everything. So I was looking for looks better because 66-year-old, you can see already see that I can work in my body, but not in my face. So Dr. Athre, I knew about Dr. Athre because my younger daughter, a few years ago, she got her eyes done with him and loved the results. So I decided to go to see Dr. Athre. And this is my results after my surgery. I'm very, very, very happy, very pleased with the personal, with him. But he's kind of funny guy, but he's fantastic. And his office.
Okay. So thank you so much for the compliments, Aura. But now I have some very serious questions for you. Okay. So first of all, tell everybody what procedures you had done.
Okay. I get done a full facelift. I have my lip
Lip lifted.
And I have a little chin implant here. What he put it just to look better, made me look younger on my neck.
Okay. Now, here is the big question. Okay. And I'm going to introduce you. So, you are one of the patients that I've done all of this under local anesthesia. So, for the world, basically, local anesthesia means numbing up the face and doing it with the patient moderately awake. Okay, so they're pretty much awake for the entire procedure. Now, you came in for a consultation. I told you I am going to do this with you awake. What did you think?
Well, it was kind of scary, because I said, I know what's a lot of work needs to be done. I said, well, I'll wait, but at the same time, I was kind of excited because I want to see, maybe I can see what he's doing. But I was kind of scared, but my experience was very good. I can tell you about it.
Okay, so I think this is very normal, and this is exactly the reason why I brought you here today. Okay, so I want the world to hear from a real patient. There's no cue cards here. I'm not cueing you. I'm not any of these things, right? So now it's normal to feel anxious. Okay, now, but were you in pain? Tell the world, like, kind of go through that day, because it was a long day. I think everything took like 8 hours or 9 hours. So
Yes.
when I've seen tons of patients after you, and I get this, their eyes get this big when I tell them I'm going to do it under local anesthesia, and it's going to take about 8 or 9 hours. That's the point where suddenly their heart goes da 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 da. So if you could talk to them and tell them, what did it feel like? And be honest. Tell them, I'm nervous. This is what hurt. This is what didn't hurt. This is what I felt like. Go through that process.
Okay. I want to be honest to you. I love it. To me, I don't know if it was me, but to me, it was great. I was kind of scared. So I get there in the surgery room. He's talking. I'm talking to him. I don't feel pain at all. Sometimes I will fall asleep. I remember he used to tell me, "Out, are you okay?" Yes, I was just talking to them, listen to them. I don't feel pain. Maybe a little uncomfortable. Pull it from here, pull it from there. I even asked him one time. I hear he was cutting something. I said, "That's my skin," and he said, "Yes." So he was pulling here. So then in the middle of the surgery, I think so. Okay, because sometimes I was falling asleep. I'm waking up again. They let me go to the bathroom. Okay, I go with the nurse to the bathroom, and more than that, I was eating a cupcake. Okay, he offered me, said, "We have cupcake in the back." I said, "Yes, I want it." I was eating a cupcake. I drink some water, go back to the surgery. Sometimes sleeping, sometimes talking to him, sometimes smiling. Fantastic, honest. I don't have pain. I was kind of uncomfortable, like I'm telling you. And I was okay. I walked to my car, walk. to my car with my daughter.
By the
And
way, I don't recommend that, by the way. Okay. She's a special case and we do walk down with her. Okay. I just want the world to know that. Okay.
yes,
Okay.
and now I can see you are using wheelchair to the patient, because my daughter, by the way, my younger daughter got the same surgery and more than that, and I thought she was in the wheelchair or something like that.
Right.
So I, to me, when I get another surgery, like I have a shoulder surgery, I need to use that anesthesia, the complete anesthesia. I hate it. I hate it. The time you wake up, you don't know. The time you feel nauseous, I don't feel any of that. I even enjoy, because Dr. Athré, I even tell you, Dr. Athré, I enjoy seeing him doing the surgery, because he's talking, he's moving, it's fun. So, and then I see my results. I do it again if I have to.
So I'm going to tell you, okay, so now you're going to get the chance to hear from me why I like to do it under local. Okay.
Uh-huh.
So local actually is more difficult for me, okay, than doing it under general. Because if you were asleep, I don't have to ask you 20 times, are you okay? Are you okay? That's number one. Number two, I don't have to stop in the middle, let you go to the bathroom, let you eat. I don't need to do those things. So from that standpoint, local actually is more difficult. Okay. It takes longer. I have to be a lot more careful with making sure you're not in pain. Okay. But this is what I like from the surgery side of things. You get to participate. So when I tell you, Aura, lift your head all the way up. Aura, can you move your head all the way this way? From that standpoint, it makes my life easier. Okay. And not only does it make it easier, what I've noticed is that the patients get a better result.
Mm-hmm.
Okay. So I had surgery about a month and a half ago. Okay. I had some sinus surgery done and I had to be asleep to have the surgery done. I hate that feeling. Like I don't remember anything for like one full day. Barbara has told me that I sent them text messages after surgery saying, I'm okay. Is everything okay? I don't remember sending the text message. Like
Uh-huh.
I have no, like what happened is just, it's a blank slate for me. And that's such a weird feeling for me. Like I don't like not being in control.
Mm-hmm.
Okay, so now you said it was easy, all this kinds of stuff. But now part two, okay? It took 8.5 hours. Okay, was that tough? I mean, or did you just not know that it was there? Because I'm not the patient, right? So you have to tell me from the patient standpoint, what does it feel like to be there for 8.5 hours?
Well, the time though, you don't feel it that much, because sometimes you fall asleep, a little sleep, and you wake up and you open your eyes again. To me, I don't feel that was that long. I know it was that long, okay, but I don't was feeling. I get cold at one time, so they bring me a blanket. So I got my blanket. I was comfortable. I was fine.
So every patient I've noticed I've done probably more than a couple of hundred this way. And this is what I've noticed about patients. Every patient is a little different. Okay. So for example, okay, you were like, no matter how much medicine I gave you, like at the end of the case, you were ready to walk and you're boom, 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 boom. Your daughter was like, okay.
Yes, yes.
Okay. So it's just different people are different. But so, first thing, I will not do local anesthesia on a guy. Okay. Only on women.
Really? And why?
Two reasons. First of all, women are way stronger. Okay. So that's A. So you remember what I asked you? I asked you a series of questions to see whether or not you could do local anesthesia.
Uh-huh.
I asked you, have you had any babies? Okay. Then I
Yes.
asked you, have you had any dental procedures? So if you're a woman, have had a baby, have had a dental procedure, something like that, I think you're going to do just fine. Okay. Guys, I've done one or two guys under local, and I mean, the first shot, it's like, oh my God, ow, wait. It's just not fun. Okay.
Uh-huh.
And then the second thing is because guys have a little bit of beard, it's a
Uh-huh.
lot more blood flow to the
Oh.
skin.
Mhm.
So when you do the surgery, what happens is there's a lot more bleeding with men. So I think that they're just better to do that under when they're asleep, because A, they're not as tough, and B, with the more bleeding, the two combination just is very difficult to do under local. Okay, so now, okay, is there any part of your procedure at any part where you said, hey, you know what? I really wish this part I wish I could have been asleep for.
Nope.
No, you do it awake the whole way.
Oh yes, not at all.
Okay. Okay. All right. So what questions do you have for me? So now you have, because this is a different perspective. You've had now the perspective where you've been a patient. And, you know, as a patient, it's a little different, right? There's things you ask your doctor. There's things you don't ask your doctor. There's a little thing. Now we're taking off the doctor hat. We've taken off the patient hat. You can ask me anything. What would you ask me now in retrospect about your case? Did you say, I wish I'd, you know, you could tell me, I wish you did this differently or something to that effect? Anything?
I know I'm very pleased with my surgery, honest. You know,
Okay.
First view, but I'm 100% there. Well, you know, the proof is my sister got it done after me. My two daughters, I mean, you're part of the family already with all these things.
This is what I told them. I said, next family reunion, I need an invite. So at least I can come for the wine and the food, right?
Yes. Now, to me, it was a very good experience. Like I'm telling you, I have another surgery, no plastic surgery done, but I have a shoulder, knee surgery. And I hate that surgery room, all that general anesthesia. No, I enjoy this.
It's scary. I mean, it's, I had surgery and I'll tell you, it was nerve wracking for me. It's like this, you're going into a box, right? And everybody has all their stuff. It's more nervous. And I feel that if we can do this under local, I think that it allows me to be able to talk to you more, tell you what's happening. So you're also more in control of your surroundings.
Exactly. And your your assistant, she's a wonderful. I can feel her peace there. And it was a very good experience, really. Good.
Yeah. I mean, Dee is amazing. She's awesome. She does her job very, very well. Yeah. All right. Aura, thank you so much for your time. I really appreciate it. Thanks for sharing your experiences. And it really helps. Like, I mean, I know that this local anesthesia thing for a lot of patients, when I describe it, is scary to them. I know that. And, you know, I hope that in the future that these patients, hearing from people like you, if I can bring their scariness from 95 to even 93 or 89, it's beneficial.
Perfect. You're welcome.
Thank you.